If you have hip impingement and you're also getting some lower back pain, here's why and a helpful tip for you to end it. Dr. Nicholas Mercer with You Improve PT. So, you have a history of hip impingement and now you're having some lower back pain. Just wanted to let you know, this is very normal. Now, the reason that you are having hip impingement may be because you have some restrictions in your muscles. Overall, there's a lot of reasons you could be having hip impingement, but you're probably lacking hip flexion, right, coming up. That's probably bothering you, and you're probably getting some pain with internal rotation and sometimes maybe external rotation. Again, very normal hip impingement symptoms. When you're having lower back pain, we usually have been having hip impingement for a while. We've been avoiding a lot of the movements of the hip that bother us, and over time, if we don't use those movements, we lose them. We don't have that range of motion anymore. So where do we compensate for that range of motion, right? So for instance, if I wanted to turn to look this way, you can see I'm rotating back into my hip to help me turn. I'm still getting rotation in my back, but I'm also getting a lot in the hip. If my hip hurts when I try to rotate, I'm going to try to rotate all the way with my back, okay? So all of that increased undue stress on the lower back causes strain on the ligaments, tendons, muscles, basically all the soft tissues of the lower back. And those kind of pull the lower back in ways that it wasn't meant to move. It wasn't meant to take all of this stress. Furthermore, another common movement, if we are going to lift something or bend over to touch something on the ground or do gardening or whatever activity you may need to do, if we're going down and we start to impinge in the hips, if we start to squat, we're going to stay like this, and we're going to try to do everything like this. We're going to rotate, right? We're going to get all that movement from our back that would ideally go through our hips, right? Because the hips are hurting, we're using the back, and now the back is hurting, right? So these compensatory patterns can cause in the future herniated discs, general lumbopelvic instability, or even restrictions in, eventually restrictions in the range of motion of your lower back, because now that's starting to hurt and you don't want to move that anymore. And then we're just going to start getting pain in a lot of different places as those compensations add onto each other. So what can we do in order to decrease this lower back pain and get our hips moving the way they should? That's a complicated question because that's a complicated condition. Hip impingement can be caused by a lot of different things, and your problems are going to be a little different from other people's. But there are a couple exercises that may help you. The first is one I talked about on my YouTube channel before, and that's the piriformis stretch. So if you're lying on your back, you're simply going to cross one leg over, right? And pull that leg over almost like it's going to your opposite chest here, right? Now, this might actually irritate your hip impingement. So what we're going to do then is bring it a little further down and just focus on pulling over. Okay? We'll hold this for about 30 seconds and do it 3 times on each side. And we want to make sure that we're not getting those pinching symptoms, we're just feeling it in the back of the hip, right? After 30 seconds, you can even start to push down and stretch this way. The goal here is getting that rotation back into the hips so that we're not compensating in our lower back anymore. Okay? All right, another one you can do is, if you're standing, this will help you take some pressure and strain off the lower back when you need to bend over, lift something, just like we were talking about before. So instead of bending over, we're actually going to get nice and tall, stick the hips back, chest forward, and you're going to try to load your hips here, okay? And then after you load the hips, we'll sink them down in order to pick something up, right? A lot of times, if we load the back of the hips first and then go to lift, we won't get as much impinging in the front of the hips, Okay, so try those 2 exercises, getting those ranges of motion back and letting your hips start to move more like hips should. And you should, over time, start to feel that lower back decrease. Some things you can do to manage your lower back pain right now, depending on what type of back pain you have. For most people, if their lower back pain is more dull, sore, and achy, putting some heat on the lower back is going to help. If it's a very sharp pain kind of in the middle of the back, you're probably going to benefit a little more from ice, but using either ice or heat on the area and then being mindful of how that makes you feel after you take off the ice or the heat will guide you as to which one is going to actually help manage that pain, right? Sometimes it's both. Sometimes it's alternating between ice and heat. But that's just to manage the back pain. It's not going to fix it. What's really important for you is probably just getting the hips to work like hips again, okay? So start doing those, see if that helps you at all. If you have any questions, please go to youimprovept.com. We have a lot of free resources on there, but also email us, contact us through the website, call us. We are really committed to helping you get rid of your back pain and your hip impingement so that you can live a long, happy, active life without these nagging hip impingement and lower back issues. So go to the website, get a lot of information from there, and get ready to improve your pain, improve your movement, and improve your life.